I'm Beth. I'm a UK trained medical doctor, and I've got a background of working as part of extreme remote environment medical teams in a number of environments, and that led me to work in Antarctica, where I was research MD for the European Space Agency. And so there I was researching the effects of isolation on the overwintering crew. So Concordia platform, which is about 1,300 kilometres from the coast and situated on Dome Charlie Plateau of Antarctica, which is kind of the Australia, New Zealand side of Antarctica, is interesting to the space agencies really for two reasons. So the first is it's an extreme environment. So if you have a look at this screenshot, which I took while I was overwintering there, the first thing you'll notice is that it's pretty chilly. So it's sort of minus 80 degrees centigrade. And the other thing is that there's a really low barometric pressure as well. So that really reflects the fact that we're at altitude. And that, together with the long polar night, where we have 105 days without any sunlight at all, means that the crew at Concordia are completely inaccessible for 9 months of the year, even in case of emergency. And this is really interesting for space agencies, because as we're looking at going further and deeper into space and exploring space further, astronauts are going to be increasingly isolated. And so platforms like Concordia are really useful and interesting to help us research some of the challenges that future astronauts on these missions might be going to face. So before we went down to Concordia, we actually went to the European Astronaut Centre in Cologne, and we had what's called human behaviour performance training. And this was a really exciting opportunity to learn about sort of our team and about human factors as well, and really how to live and work together effectively as part of an overwintering crew. And there's a huge emphasis in this training on sort of what it's like to come back home afterwards. And I was really surprised by that when I was having that training, you know, sort of travelling from London, where I was working as a junior doctor at Chelsea and Westminster, you know, I was going out all the time. And it seemed really alien to me, the idea that I couldn't remember my PIN number. And I really didn't think that it would happen to me. But certainly after sort of 12 months of isolation, so this was after a year now, and when the first plane came back, I did start to relate to some of the training that we'd had at that point about going home. While it was a really great experience for everybody to come back, you know, it was really emotional to see all of the crew that had left us during the summer months, because we'd had about sort of 3 months altogether where we were preparing for the overwinter. It really was a strange time as well. And I was really excited about going home and what that would mean. But also, I think a lot of us also felt actually pretty lost. And I think that this is something as well that a lot of people can relate to with the current pandemic and coming out of lockdown as well. And it really was a big surprise to me that I did feel like that. And I think that there's two real reasons for that. And I suppose the one is that not all the things of that experience was bad. So there's definitely positive things that you can bring from that experience. And also, change is always hard. So first, I'm just going to focus on some of the positive things that I took from that experience. And I've chosen things which I think particularly relate to life in lockdown and life during coronavirus for all of us. So the one is a real sense of community, you know. It's often historically said that Concordia, actually one of the easiest overwinters, was actually the first overwinter where the crew actually had to finish building the station because it hadn't quite been finished. And they had that sort of shared goal which they're all working towards. And that's traditionally, and sort of scientific research also reflects this, this really does help aid crew cohesion, having this shared goal. And I think working in intensive care during the pandemic, I've really seen that amongst sort of NHS teams, and I really think that having had the sort of goal of treating patients with coronavirus has really brought us together as a healthcare system, and I really hope that that sense of camaraderie continues. The other thing is that you felt part of something bigger than yourselves, you know, sort of when you're down in Antarctica, you're part of scientific research bases, small international crews, all working towards sort of scientific research. And because of that, you really feel a sense of community. And while I didn't meet any of the other sort of overwinterers on the other stations, we did send them sort of midwinter cards, and this is actually a picture that we we took to send to each other. And we participated in different sort of transantarctic events, from sort of darts tournaments to a sort of transantarctic film festival. And you really did feel connected to all the different overwinterers on these other stations because of that experience that you're all sharing. And I think that that's also similar with sort of the fight against COVID as well. You know, it really is truly a global pandemic. And I really noticed that, especially in the first wave, when sort of I was participating in a conference call over Zoom to doctors working in Italy. And they were helping to prepare us for what was about to come, and really helping to sort of inform us about some of the challenges that they'd faced. And you really did feel part of this huge global effort. And that's not only just in the workplace, but I think this also is reflected in communities. And I know, while it's of course been socially distanced, I think we have seen sort of communities come together, with people doing shopping for each other, and outside of the healthcare system as well. You know, all different sort of areas of work and workplaces have really had to sort of work outside the box and try and find solutions together, which has really brought a sort of sense of community amongst those groups as well. And not only that, I mean, whenever you want to live in an unusual environment, so for example, sort of living in an extreme environment or going to space, or whether it be fighting a global pandemic, you really have to think outside the box. And it really is the driving force behind a lot of research and technological innovation. And we've certainly seen this over this last year. And when we were down in Antarctica, we were focusing a lot on sort of telemedicine and remote diagnostics. And it's been really exciting to see that now being used clinically in the workplace on a much wider scale. And so it really does make you sort of change the way that you're working and the way that you're thinking about it in a way that you probably wouldn't without these sort of big challenges which are brought to you. It also offers you a bit of time for creativity, of course. So this is a midwinter cake that we all made as a crew, and also a time to connect with nature as well and really take in your surroundings. But not only do you connect, but you also offer the opportunity to disconnect as well from life a little bit. And I think one of the sort of defining things for me when I was in Antarctica was actually losing the sun. So, you know, the sun is really that familiar feature that you see wherever you are in the world and wherever you go traveling. And to lose that really did feel like I was sort of disconnecting from life back home. And it really does offer you a bit of a fresh perspective on what you're doing with your life and where you want to take it as well. And astronauts often talk of the overview effect, and what they're talking about is looking back on Earth sort of through the cupola window and offering that sort of fresh perspective on how they see the world. And while during the pandemic, of course, we haven't been to space or Antarctica, I do think that it has offered us the opportunity to really sort of step back from our day-to-day lives and think about what it is that we want to do in the future and what we want that future to be. Of course, you know, we miss things when we're in Antarctica, and that sort of deprivation, whether it be sensory deprivation of not having any mud or any sort of water to jump in. You know, I hadn't been submerged in water, which is a weird thing to miss, really, but it was something that I wanted to do as soon as I got back to the first lake I saw. But you also sort of miss seeing old people, young people there, fresh fruit and vegetables, and of course friends and family. And I think it really does make you appreciate the little things, and they do taste all that more sweeter when you do get to have them after all that time. And I think a lot of us are looking forward to having, you know, that sort of first glass of wine outside in the beer garden when things do start to open up a bit more, and you really do start to not only appreciate things, but also realise what isn't important as well to you. So these are the things that I think that I sort of missed from the experience, and that I was sad to be leaving. But also I was sort of a little bit nervous as well about the idea of change, because of course, you know, going to Antarctica in itself and experiencing that overwinter is a huge change from sort of your normal day-to-day life, and you're kind of just about getting to the swing of things, and then suddenly you're expected to have to change again. And I think, again, a lot of us can relate to that. You know, we kind of just got into the swing of this lockdown, and then suddenly we're going to have to go out to this new normal, which isn't going to be what we were in before, isn't what we're in at the moment, and we don't really know quite what to expect, and that's a little bit scary. And whether that's sort of environmental changes, so we had the summer crew coming back, sort of bringing the overland traverse with all the food and fuel and equipment and sort of invading our home in many ways is how people saw it. And whether it's as innocuous as kind of moving from the kettle to buy the toaster, which actually upset quite a lot of people weirdly, to whether it sort of changes in yourself, there's a lot of changes that do happen. And I don't think you can avoid changing through these big experiences. And I think the people that really struggled actually when they were going home from Antarctica were the people that tried to slot back into their lives as they were before. So, you know, you sort of slot back to the same partner, same job, same car, same house, same sort of commute to work. And they found it really difficult after they'd had this sort of life-changing experience to try and sort of fit back into that life that they had before. And I think I was quite fortunate in that respect, because I was actually going from sort of working as a junior doctor in London, and that sort of experience had ended for me. So I couldn't go back to that because it no longer existed. And so you had to sort of pave a new life out for yourself. And I think that was in many ways a lot easier than trying to go back to what it was. And I don't think it's possible really to do that. And we can't avoid the fact that we're all a little bit socially awkward once we've been in isolation for a period of time. And what I think it will be interesting to see is, because we're all a little bit socially awkward. I mean, when I came back from Antarctica, I was the only one that was socially awkward because all my friends had just been carrying on with life as normal. And so I think it was quite easy to kind of slip back into normal day-to-day life. But I think it'll be interesting to see how we cope when everybody's been affected from being slightly socially awkward. But it should change, and hopefully we'll get used to it in time. And this is really reflected in the research that we're doing. So this is a NASA funded project, and we're doing functional MRI scanning of our brains, initially just before the mission, immediately after the mission, and then again 6 months after that. And we did see sort of functional changes in our brains on the MRI scans after that period of isolation. But that did resolve after we'd spent sort of time back in normal sort of social settings. And it's not that you forget how to do things, you just become a little bit more inefficient at doing them. And, you know, I had to kind of relearn to drive. So this is Jackie. He taught me how to learn that cat tractor that you can see there. So, you know, I had to sort of learn to drive again to drive back across Antarctica. And my poor friend Alice, she came and sort of scooped me up in New Zealand, which is where I got the boat to, and really sort of helped me sort of reintegrate into life back home. And, you know, I felt myself, normally quite a confident person, sort of hiding behind her a little bit as we checked into hotels and feeling a little bit nervous going on buses and in large groups of people. And it soon wore off, but it did take me a little time to readjust, you know, just going into a shop and buying stuff. Like, I could do it, but I was just a little bit slow and clunky. And I did tragically forget my PIN number, which is what they all said was going to happen. And I really didn't believe that I would. And you do get a sort of sense of, it's a little bit institutionalized being in Antarctica, and because of that, a lot of people that sort of have careers in the military, so classically submariners, are attracted to go and overwinter. And the life there is very simple. You know, you don't have all of the distractions that you have in normal life, and that can actually be really refreshing as well. And so I think people struggle when they sort of try to go back to their normal lives, just because of all the chaos, you know, of having to choose between like 60 different brands of washing powder and all these other sort of decisions, which actually life in Antarctica you don't have to make. And plus you have an Italian chef the whole time, so you really can't complain. So I think although the pandemic, of course, hasn't been a journey that we've chosen to be on, it's one that we've all had and one that we've all shared together. And I really do think that it has brought everybody the opportunity to sort of see the world a little bit differently. And I don't think we are going to go back to the world as it was before. I think we are going to go to sort of a new normal, as it were. And I'm actually really excited to see what that new normal is going to be. And I think it has a lot of potential for a lot of really positive changes. So I'm actually really excited to see what the next few months bring. Thank you.